Okay, this video is what is the best diet for diabetes, okay? And I can tell you most patients in my experience, they just go with authority. They go, oh, well, I have a diabetes doctor. My diabetes is under control. I'm taking metformin, okay? I talk to kidney patients, patients with diabetes and kidney failure. And I say, you know what, you might want to improve your diet. If you like, I can explain it to you. And they're like, oh, it's okay, doc. I have a kidney doctor. I have a diabetes doctor. It's under control. I'm going to a kidney specialist. Kidney doctors usually don't know anything about nutrition. They just want to get the patient on dialysis, start making money off them. Okay, anyways, I just see that all the time. I've known lots of patients over the years. They don't want to hear what I have to say. They want to go to their diabetes specialist, okay? And so anyways, here's what's funny. There's a foundation for diabetes. It's called American Diabetic Association, ADA. And they've got a whole bunch of recipes for the diabetic patients. And Nathan Pritikin had joked about this a long time ago. He said the ADA diet is designed to make sure the patient never gets better from their diabetes. So I just want to share with you one of their recipes. Here is a recipe for let me see if I can get myself a little here. Here's a recipe for meatloaf. They have a meatloaf, quick Italian meatloaf. 210 calories total. Of that, 8 grams are from fat, plus there's additional calories cholesterol. I don't know if they include that in their fat or not, but 8 grams of calories from fat. That's a lot of fat out of 210 calories. So you multiply that times 9, because there's 9 calories per gram of fat, and you get 72 calories from fat. You do the percentage on it, 34% of the calories are from fat. That's super high in fat. That will make you insulin resistant. That'll continue your diabetes. Nathan Pritikin used to joke, all Americans are diabetic after dinner. They come in the morning for an oral glucose tolerance test, and they starved overnight, so they're less likely to test positive for insulin resistance. But you test them after a high-fat dinner, they'll test positive for oral glucose tolerance test. So that was funny, a Pritikin. And just for comparison, so this is a 34% fat, this meal. And I mean, this is just one meal, but all foundations for any disease, this isn't just diabetes, it's all foundations. They make money by people coming to them, donating them money, or participating in their programs. What I'm trying to say is, if they cure the disease, they lose the patient. Just like conventional medicine. Cure the patient, you lose the customer. All right, so they don't want to cure the patient. None of these foundations. I've never in my life heard of a foundation that cures its patients. Okay, so take a look at the relative fat percentages. The ADA meal, and again, I don't know all their meals, but I know there's other meals. I saw one for fried chicken or something. Okay, 34% calories from fat. Kempner fed his patients 2% calories from fat, and Dr. McDougall said he cured all his type 2 diabetics, okay? So you got to get to them before they've lost their pancreas beta cells, but McDougall said he was curing all of his type 2 diabetics. The McDougall diet, Pritikin diet's got a tiny bit more fat, about 2%, 1 or 2% more, but it's in the ballpark. Pritikin diet, the Veg Source diet, Jeff Nelson eats, and recommends the Esselstyn diet, the Spartan vegan diet. They're all in the ballpark of 5 to 10% of calories from fat. The Papua New Guinea diet, eating all those sweet potatoes, that's less than 5% of calories from fat. Okay, and they don't have a problem with diabetes back when they eat the rice in the Asian countries. So Dr. McDougall had said, diabetics should be fat counting, not carb counting. Okay, because it's the fat that causes insulin resistance. Okay, sodium makes it worse. Okay, and look at the sodium ratios here. You always want to look at the ratios of sodium to potassium. They've got 360 milligrams per serving of sodium and 344 milligrams of potassium. That means there's more sodium than potassium. That's bad. You want always at least 5 times more potassium than sodium. Otherwise, you're predisposed to hypertension. Richard Moore, MD, PhD, who wrote the book High Blood Pressure Solution, it's the best book ever written on blood pressure, he said you always want to be at least have your K factor, the ratio of potassium to sodium, at least 5. And if you look at our ancestors, they were eating at least about 15 to 20, I think probably 20 to 25 times more potassium than sodium. Because potassium is a vasodilator, sodium is a vasoconstrictor. Sodium causes hypertension, potassium prevents it. All the good stuff's basically in plants. But anyways, I just show you this to get you an idea, because I remember years ago when I was trying to understand diabetes, and I figured I'll go to the grocery store and I'll look at all the diabetic food, because I knew they had a special area of food for diabetics, and I figured that will be the healthiest food in the world. I got to see what it is. And I went there, and it was all these high-fat candy bars and other stuff. I thought it was a big joke.